The morning sun is sending its light to the earth. Farmers waiting for the day to begin are accomplishing their regular tasks. They seem to be pretty busy on their land since early in the morning to win over life. Meanwhile, health is a priceless asset, desperately required to lead a better life. And as such, quality health service is unconditionally essential.
ጤና ሁኑ ጤና መሪ ይስፋፋ መንግስታችንም ይቆይ ህዝቡም ደህና ይሁን ታላይ ንጉሶ ተታይ ጉስጉሱ ደህና ይሁን ሁሉም ይስማማ ጤናን ዘናብም ሰጥቶን ደህና እንሁን ጤና መሪን እየቀጠለ እየተስፋፋ ይሁን.
This blessing is to commend community-based health insurance scheme that started at a pilot level a few years ago. The service was started in 13 districts of the states of Oromia, Southern People, Amhara and Tigray in April 2011.
የጤና ወጪ በከተማም ይሁን በገጠር በመደበኛ ክፍለ ኢኮኖሚ ውስጥ የተሰማራም ይሁን
health service expense is increasing over time both in rural and urban areas. Individuals are not in a position to bear with the increasing expense. The primary significance of community-based health insurance is to reduce the burden of the expense.
በራሳቸው በመደጋገፍ የተሻለ አገልግሎት እንዲያገኙና ፍትሃዊነቱ እንዲጠበቅ ማድረግ ነው.
The pilot implementation of community-based health insurance didn't come out of the blue, but rather it came to action after various research and consultations.
አግባብነት ያለው ጤናን ፋይናንስ የማድረጊያ ስልት አይደለም ከኪስ አውጥቶ ከፍሎ የመታከም ስራ
Obtaining health service on pay basis is not an appropriate means of financing health. That is why the Ministry of Health is implementing health insurance with the bid to provide better service in an organized system.
Strategy መነደፍ ነበረበት ስትራቴጂው ወጣ.
Waziro Asalef Tsagal is a farmer in the Telehudere district of Southern Wollo Zone. She states that community-based health insurance is prominent for her and her fellow farmers.
ጤና መድን በጣም ጠቃሚ ነው. ገበሬ ያው በ6 ወርና በአመት ነው የሚያገኘው ምርት.
Health insurance is very important. A farmer can only get harvest in 6 months or a year. I'm now receiving health service thanks to the launching of health insurance. Once I pay my share for the scheme, I've the privilege to a year-long health service.
ገንዘብ አለኝ ማለት ነው ጤና መድን ላይ.
Ato Gemabasa and his spouse Waziro Milke Gida have lived together for long enough through bad and good. They emphasized that the starting of community-based health insurance in their district is a relief for them.
Before the introduction of health insurance, it was hard for the poor to get health services. They had to sell their cattle if they were to get a health service. But since the beginning of community-based health insurance, we just fill in a form and are easily entitled to health services.
I'm alive to date because of the medication I got from community-based health insurance.
Health service provision and reception in Ethiopia is 10% below the standard set by World Health Organization WHO. When we think of the segment of the society engaged in informal economic sector, the trend is even worse than that.
We are now in the Abraha Wo Atzbaha locality in Kilete Aulalo district in Tigray state. Ato Brahana Mahare is checking beehives in the backyard, whilst his spouse Waziro Bahayalan Hushe is making coffee at home. both agree that community-based health insurance is of great significance for their family. Before the start of health insurance, we looked to borrow money, but ended up unlucky. In between, people may die because we don't dare go to a health facility without having money.
If my children catch malaria, they get medication as quickly as possible. So do I and my wife. We feel like home away from home.
Ato Tefera Meskelu is a resident of the Gimbicho district in Oromia state. He spent most of his time looking after his wife before death took her away from him. He now talks about community-based health insurance, comparing it with a previous scenario.
I lived for more than 19 years together with my wife. We used to be beneficiaries of health insurance for 2 years prior to her death. I spent all my money I had saved in a bank to medicate my wife. However, since 2 years now, we are embraced under health insurance scheme. The insurance has saved me a lot of money as I have been able to get treatment with little payment.
Waziro Brahane Hey is a neighbour to Ato Tefera. She witnesses that the insurance has brought health itself to her house.
When our children get sick, we have them treated without payment within a reasonable span of time. We can call and communicate with health experts because of the system. We owe big thanks to the government for having made things easier.
On the other side, community-based health insurance is believed to have contributed greatly to service providers.
በፊት ያው ሰዎች ይታመሙ ነበር ሲታመሙ ብር ያላቸው መጥቶ ይታከሙ ነበር
When poor people get sick, they used to sell their property to obtain medication. But after the advent of community-based health insurance, every individual is able to access health services.
ዋስትና ነውና ማንኛውም ሰው የመጣ ይታከማል ማለት ነው
አርሶ አደሮቻችን
Farmers didn't go to health facilities unless and otherwise they had money on hand. But now, the poor and the rich can equally be treated as a result of the insurance.
Community-based health insurance is also helping health institutions become financially strong.
The source of income for health facilities is growing. It is increasing month after month.
Recently, a field visit had been arranged to look at the implementation of the health insurance scheme. During the occasion, beneficiaries have elaborated the effect of the programme.
After seeing the good change on me, this guy managed to be free from his pain. Previously, he used to suffer a lot since he was unable to cover the expense for medication. I was sick myself and got treated only with 95 birr. When I told him my experience, he went to a health facility and got 1 kilo of flesh removed from his neck. Thanks to health insurance, he is relieved from his pain only with 3 birr. May health insurance flourish and the government live long.
ያው ድቅ በሽታ ያዛት ሳትወ ላይ ወደቀች አሁን እኔ ጎጥ ላይ ማለት ነው እኔ ያስኩት ጎጥ ላይ እና በጣም ደሃናት
She used to suffer a lot. She is so poor. She fell onto fire and was severely burnt. The medical expense was much more to the extent even the rich can't easily afford it. We provided her money from our local ECOB and she underwent a 6-month treatment and finally healed. If we calculate the treatment in terms of money, It's so big. It's because of health insurance she maintained her health.
ገንዘብ ብትል ለመሳፈሪያ የተዋጣላት ሰው እንዴት ብላ ትድናለች? አትድንም ነበር። ግን ጤና መድን ስላላት ታከማዲያ ነች። በጤና መድን
አንድ ትልቅ ችግር እንቀርፋለን ብለን አስበን የነበረው ምንድነው? ህብረተሰቡ ወደ ጤና ተቋም ሲሄድ
Previously, people were required to pay money for the treatment they get, and the fear of having insufficient penny held them back from visiting a health facility. However, the introduction of health insurance has remarkably improved the community's trend of going to a health institution.
አባል የሆነው ህብረተሰብ ወደ ጤና ተቋም መሄድ ልምዱን ባህሩን እያዳበረ ነው ያለው።
Some of the personalities that took part in the visit were taken by surprise regarding the benefit people are reaping out of the implementation of community-based health insurance.
የጤና መድንን በራሳቸው ቋንቋ ጠርተው የራሳቸው እስከማድረግ ድረስ
They have internalized health insurance with their life. Each and every one of them speaks boldly that they are satisfied with the program. I'm so overwhelmed with that.
ሲናገሩ ሰምቻለሁና እጅግ በጣም ነው ገረመኝ።
ቢወልዱም ቢታመሙ ልጆቻቸውም ባላቸውም ሁሉም ቢታመም የትኛውም ሰዓት ላይ የህክምና ሰርቪስ ማግኘት እንደሚችሉ
They are confident they can get health service anytime they need it. I've taken note that they hold a weekly awareness raising program. Their confidence and social interaction is impressive.
እርስ በርስ ሲናገሩ ያላቸው መቀራረብ በጣም የሚገርም ነውና ስለ ጤና መድን ያላቸውን ግንዛቤ እጅግ በጣም አድንቀዋለሁ።
Many agree that the role of administrative bodies is vital for the success of the implementation of health insurance.
ትልቅ ለውጥ አለ።
There is a big change. That is because the awareness of the management about the scheme is growing.
እየዳበረ እየጎለበተ በመምጣቱ
በቅርብ ጊዜ ቦርዱ አለ ይሄን የሚገምገም ቦርድ አለ ቦርዱ ገምገም
There is a board that evaluates how the scheme is progressing. Based on our assessment, we have seen that there is no attitudinal problem and lack of awareness among the public. The management at various levels has decided to work towards attaining 100% health insurance coverage in our district.
ወራካቢ ሆኗል። ከዛ በኋላ ነው ይሄ ቅድም ያሉ አባላትን ወደ አባልነት መምጣት የጀመሩት።
ጃፓን የጤና መድኗን ተግባራዊ ያደረገችው በ1922 ነው።
Japan started implementing health insurance in 1922, yet it took about 39 years for the country to make the service accessible among its entire citizens. Ethiopia, for certain, is not to take that long to make it happen. Japan's life expectancy is the highest in the world, the average being 86 years, but Ethiopia's is among the lowest, though there are some progresses. So, community-based health insurance is anticipated to improve the living standard of the multitude, and it will be translated into action upon working hand in glove.
የህብረተሰቡ የመኖር ይሄ የመዋደድ የመታሰብ ባህላችንን ይዘን ትልቅ ዕድሜ እንዲሰጠን እንግዲህ ሁላችንም ተስፋ እናደርግ።
It's inherent that human beings wish to lead a healthy life. And to make that happen, establishing a comprehensive health system is mandatory. The government needs to invest a lot to reach that level of success. And Ethiopia seems to have started the long journey by scaling up best practices from other countries.
مرحبا